Thank you for joining us on this Sunday. As hospitals and emergency rooms across the country are under increasing strain, Canada's provincial and territorial leaders are increasing their political pressure on Ottawa when it comes to increased healthcare funding. This week, the Council of the Federation launched a new ad campaign calling for Ottawa to meet and negotiate a new deal. I spoke to New Brunswick's Premier Blaine Higgs about the strategy and the current strain on the system in his province. Premier Higgs, nice to see you as always.
Nice to be here, Rosemary.
I want to start with this ad campaign that the Council of Federation, all premiers and leaders have launched this week, demanding more healthcare funding from Ottawa and to sit down and talk with the Prime Minister about it. Why did the provinces and territories decide this was the best approach?
Well, it's kind of unfortunate it's come to this, but there has been talks, as you know, for the last 2 years to 3 years, longer, of getting together to try to come to a more equitable sharing of healthcare costs that have been always on the rise, but no more so than in the last few years. And the meetings haven't been scheduled, and there's been commitments made that the meetings would be this fall, and actually that there would be money allotted in the upcoming federal budget for next year. So I think that this is an attempt to bring attention to it in a way that healthcare is at our foremost priority across the country. And let's get this meeting on the way. And I think, and let's agree on what healthcare improvements can be made in the system. And I'm always also keen on sharing best practices between provinces.
Well, the Toronto Star and my colleague and friend Althea Raj reported on Friday that the Prime Minister won't sit down with the provinces and territories until there's some sort of agreed upon framework in place, and that there have to be conditions. I guess, does that make sense to you to have something in place before you even sit down? Are you open to conditions which I guess the government is describing as light?
Well, I am open to that because I think we all need to understand how do we improve healthcare. And I think we all agree that, we have to be innovative in healthcare delivery, more so now than ever before. And although more funding is needed, we understand that. But we have to understand what the funding is going to be used for. And is it actually going to achieve better results for patients? Because that has to be goal number one. And it's not a case of, if I get more money, well, what am I going to do with it? Well, if I can't identify that I'm going to use it for a specific purpose in order to get better results for the citizens, in my case of New Brunswick, then shame on me. Because that's what it's all about. We know we've got backlogs in surgery. We got conditions that were heightened because of the pandemic. We know we have shortage of staff across the country. We're all looking for more people, but we just can't compete for more people. We have to find better ways to deliver healthcare.
One of the other things that apparently Ottawa is thinking about is that you have to obviously take the money for healthcare funding and you have to use it on healthcare funding. And in the past that hasn't always been the case. Sometimes provinces take the money and then reduce their own healthcare contributions. Do you feel like that is a fair thing for the federal government to ask provinces?
Yes, I do. I mean, and I've said that in my own end. I've said that, look, whatever we receive from the federal government for healthcare funding will not decrease our budget. We will put it in being able to have better services and to deliver better results. So I do think that there's it's not I think the rub here is it's not about that we all couldn't agree on what better healthcare could look like and what that means given some of the challenges we've each faced and all have similarities. It's like we may have different ways to achieve that result. So don't prescribe how we achieve it, but having us have that discussion about what's to be achieved, I think is a valid point.
What do you say, though, Premier, when you go to Ottawa and you're asking for more money and they say, oh, Premier, we happen to notice your $700 million surplus last year, so why aren't you using that money to put that into your own healthcare problem? And you wouldn't be the only one who has a surplus. Ontario has one as well. So what do you say when Ottawa says to you, you've got money, just increase your own budget?
Well, we have certainly increased our own budget. We increased our healthcare budget last year by about $300 million. And since that time, I think we've made about 20 different announcements in relation to improved healthcare funding. But there's also improved housing funding. We did about a $100 million investment over this last week in that regard. But I could go through multiple millions of dollars in many categories. So it's not just health. Sure. And we will continue to do that. So it's not about not using what we're able to do ourselves. It's about a fair and equitable formula that has got out of step with the reality of healthcare costs.
How important do you think it is for the provinces to maintain a united front? Because we have seen in the past, Premier Gallant in your province, and other deals, I should say, that Ottawa has managed to achieve with provinces, daycare would be another one, where the federal government starts to pick off provinces and come up with deals unilaterally in order to solve the problem. How important is it for provinces not to bend in being united, or does it matter to you?
Yes, it does matter. I think it's critical that we stick together.
And that is because otherwise the outcomes will not be as good?
This is a collective initiative recognizing a formula that's flawed, a formula that does not share equitably in every province the increased healthcare costs that we're all experiencing. We have been united in this throughout, as collective provinces and territories, and we will continue to do so. And I think it's very important that we arrive at a funding agreement that works for all of our provinces.
In your throne speech this week there, you promised to address surgery backlogs, help people find a family doctor. What is the biggest challenge in New Brunswick right now in terms of your healthcare system and the struggles you're facing?
Well, staffing would be the critical one for sure, but that goes into because everyone's competing for more healthcare workers, more professionals. So immigration plays a key role in that. So the federal government can certainly help in that category, that we can bring more people in. We're looking at different certification processes, getting more healthcare professionals involved, whether it be paramedics or nurse practitioners or pharmacists to do more and take some of the load off of the healthcare professionals in terms of doctors or nurses. We're also, changing the practices in ways that we can look at between provinces and say, if we have backlogs in surgeries, is that something we could collectively do in one area over another one? Yeah. Could we look at different methods of healthcare and how it's delivered so we can do higher volumes than we currently do in the current methods? So there are those different methods of doing things, but there's also the situation that's real. Doctors today and healthcare professionals aren't going to take 4,000 and 5,000 and 6,000 patients or more like they did years ago because they want to balance work life, and that's very understandable.
We are expecting the fiscal update next Thursday here in Ottawa. What are you expecting there, if anything, in terms of support for people who are struggling with inflation as we head into a very difficult time with higher interest rates as well?
That's right, Rosemary, and we're looking very closely at how we can effectively help the working, often referred to, and maybe not in the right terms, but as the working poor who are working every day, but through inflationary costs are finding it more and more and more difficult. And we're looking at how do we bridge that. And that brings to the point of, when you talk about our current surplus, we don't know how long that's going to last. But can we help people through this scenario and this situation while it does exist? And then as we move forward, watching closely what the economics look like. We've seen changes in economics in our province like we have never seen before in our history. Our population has grown faster than it did going way back to Confederation. But that bubble, we'd like to see it last, but we can't count on it. We have to manage through it.
Premier, you're always very kind to make the time for us. I appreciate it, sir.
You're very welcome. Have a good day.